Welcome back to the City Current Radio Show. I'm your host, Jeremy Park. We're honored to be with our next guest. They are the co-owners and co-providers with ZpMed, and we are talking with Dr. Shannon and Lloyd Finks. How are you two doing?
Hey, Jeremy, we're doing great. How are you?
Doing well.
Super.
So I got to start out. So when you talk about ZpMed, talk about the name. So let's start with the name.
Sure. So this goes back to my Aunt Sally, one of my favorite aunts, my dad's sister, who was a very talented and very well-respected nutritionist in one of the New York hospitals. She was Jewish. She was, if you ever wanted to cast a Jewish sitcom, she was your lady. And she used to talk about Zup. Zup is the best medicine. It cures everything. And so Zup is Yiddish for soup. It's related to Italian zuppa, and basically it's what we wanted to do when we started this clinic. We want to be warm, we want to be healthy, we want to be all good things and reassuring and generally just healthy.
Healthy. And there's also a New England Journal paper on the healing powers of the chicken noodle soup. And so we really want to offer healing through just the experience that Zup can offer. And that's how the name came about for ZpMed.
Yeah.
And that way, hopefully all of us will pronounce it correctly.
No,
you can say it. We've had people say, "What's up, ZpMed? What's up?" And then we've had people say "zoop," like soup. But we've had to train our staff. You say "book," "cook," "look." It's that sound in all of those. So it's ZpMed.
ZpMed. So let's talk about what you do. So you do a lot, and you have an actual physical location so people can come to you. You've got virtual, and so you can obviously meet people where they are using technology, and then you go to people as well. So talk about what you do.
So we are a concierge medicine practice. When Lloyd and I envisioned this clinic, we wanted to combine each of our disciplines. We each had internal medicine for over 20 years. I am a PharmD by training and taught in the pharmacy school and medical school pharmacology. And so I come at this from a drug therapy standpoint. And we had envisioned a practice where very much our disciplines would come together. I would be a part of walking a patient through the many medication interactions or using supplements instead of FDA-approved medicines to improve care and overall. And then Lloyd would be mainly responsible for internal medicine issues, for urgent care issues. And we blended our two disciplines. We wanted to be able to think outside the box. We wanted to bring white glove service to the medical industry, because if you've ever had to sit in a waiting room for more than 2 hours or 8 hours in the emergency department, you're well aware that medicine itself is not known for its white glove approach. But we wanted to combine multiple hats, multiple disciplines, but then also go a step further and be able to meet patients where they were, in their homes, in their offices, in our clinic. And it was very important to us to be able to think outside the box and help patients with where they want to go. They have a decision and they have a part in their healthcare.
I know you also work with companies. Exactly what she said. You also work with companies too, in terms of being able to scale it. So talk about your work on the corporate side.
Well, our work begins with the individual. And from the corporate side, we approach groups of people yet as individuals. So our corporate entities tend to use us as executive benefits, perhaps more than anything else. They like the personal touch that we're able to give, but probably just as important from an efficiency standpoint, we're able to take somebody and see them immediately. We guarantee same-day service for our members. And in fact, even for most non-members, we're still able to go ahead and produce same-day service. And so I think what this has allowed us to do, and what Shannon didn't mention, is that we don't take insurance. We're a cash-only business. And by doing so, it allows us tremendous freedom to practice medicine the way that we have been trained and have been, in fact, taught for the last over 20 years. Both Shannon and I teach clinical medicine, but also allowed us to go ahead and treat patients quickly and efficiently, without having to worry about what somebody else is going to say. Oh, we're not going to pay for that. So it allows us to practice medicine the way that we believe should be done.
So one of the statistics, one of the national statistics, is if you go to your primary care physician's office, you spend an average of about 12 minutes with that physician, and that physician can spend about 38 seconds with you on new medicines. And instead
Slow that down and say it again. It's 38 seconds.
38 seconds
Discussing new medications,
which are hugely important to controlling chronic diseases and hugely important in preventative health. You want to make sure someone understands new medicines. Our model incorporates an hour with the patient, and we price our time very transparently, but it's a totally different model looking outside the insurance world. I will say that Lloyd said we don't file insurance, but a person who comes to ZUP is able to use our itemized receipt and submit it on their own for reimbursement from their insurance company directly. So we're kind of rebels. We're trying to imagine healthcare in a different lens, and we're trying to make the overall experience different and more meaningful for a patient by doing things the way that we are.
Yeah, and I think for listeners, an analogy that goes with this is St. Jude. When you look at why St. Jude is effective, and they push this out, is the fact that they can do whatever needs to be done for the benefit of the child. So they're not worried about, will they get reimbursed for this? If it needs to be done, they're going to do it because it's the right thing. And just like you mentioned, you can do the same thing. If it's right for the patient, you can do it versus having to worry about, okay, are we going to get reimbursed? Does this follow the, we can do it because it's the right thing that needs to be done, and take your time to fully explain what's going on. And so the concierge approach to me really is important because it gives you the freedom, the flexibility, but also the control to be able to do what's right. And so I think everything you're talking about, it really does kind of illustrate why you're able to get the results you're able to get in this model.
Jeremy, you just said something so beautiful, and I'm going to borrow that from you in the future. You were able to say what we were intending to say very well.
Hey, well, this is recorded, so you can use it, as much as you can. So talk about vaccines, COVID-19. Give us a little bit of your perspective in terms of what's going on right now.
So let me start, and then I'll let you jump in. So when we first dreamed of this concierge clinic, it took 2.5 years from start to finish to develop the model, to come up with our plan, to hire construction, to
That's me.
Answer phones. And when we opened on March the 20th, 2020. We opened exactly 24 hours before the mayor shut the city down for COVID. And so one of the things about being small and nimble and new, and as we looked out over an empty parking lot, we decided very quickly, this concierge medicine thing may not work as well as we thought. But on the flip side, it worked fairly well because we were able to focus on what the community needed, and that was a COVID resource center, if you will. COVID is probably 50% or more of what we do, especially right now with the surge. And what we know is that people have misinformation, people are scared, people don't know what to anticipate if they come back with a positive result. And we've stepped into this role and take it very seriously.
I don't think there was anywhere in our financial model and our pro forma that mentioned COVID. And as Shannon said, being small saved us. It was immediately following the startup, and we knew that we couldn't bring people into the clinic, but we also had to offer a service. And through that need, we've been able to develop expertise that has become valuable to a market segment that truly we really had never anticipated. We take care of a lot of travelers, international travelers, who are struggling to interpret what their individual destinations specify for requirements for COVID testing. We've also found ourselves taking care of numerous film crews and production companies. Shannon and I both come from musical homes. We have a musician's son, and so we're very comfortable with the entertainment industry. We've both grown up with that, but we never had experience with film and television. So we've grown that. Shannon has become our resident expert in the Screen Actors Guild requirements and union requirements. And so we now provide COVID compliance officers to these different film crews. We go ahead and do lots of different types of testing, and that has saved us and also has grown a revenue side that we never anticipated.
Yeah, and a really cool specialization too. I mean, to step into that world and get those sort of connections and relationships is really neat.
Well,
what would your words of encouragement be? Well, what would your words of encouragement be, or how are you encouraging clients on your end for the vaccine?
So I think the biggest perspective that I could take away from the last 6, 8, 12 months is that everyone has a reason for either becoming vaccinated, being the first in line, maybe even cheating and going to outside of state to get the vaccine early, versus holding out till the very end. We value everyone's opinion, and we're living in a pandemic where we're watching things play out in real time, and we don't have the perspective of years and years of clinical data going into this decision. But I think at the end of the day, we have to make the best decision for our communities. And vaccination right now is a very important decision to make. And it not only affects you, it affects your loved ones, it affects your neighbors, it affects people that you don't know. And for us, in seeing right now with the surge, both vaccinated and unvaccinated, by far, vaccination helps symptoms be mild. It helps people stay out of the hospital. The most recent statistic is the unvaccinated are 29 times more likely to be hospitalized. We also know that 25-fold reductions in death and hospitalizations and being on a ventilator. And then long hauler symptoms are less in patients who are vaccinated. There are multiple reasons. Is there a risk with vaccination? Certainly, there's a risk with every medicine, but the benefits far outseed the risks, in our opinion, at this point in time. And we're open to learning, as we all are, but I think the data up until this point certainly suggests that vaccination is a key player in helping us in this pandemic.
Yeah.
I think what Shannon said is so critically important. This cannot be an argument about politics or religion. This has to be one of benefit versus risk. And the truth of the matter is, while there may be some risk in this vaccine, we have 10 or 12 years of using messenger RNA technology. So this is not a new concept at all. And yet we also know on this side that it is terribly dangerous right now to be unvaccinated, both to yourself and to the people around you. So in our minds, we believe, and all we can do is encourage people. We'll take care of you either way, but we believe that there is no choice other than vaccination right now.
Yeah. My family, all of us, brothers, family, parents, everyone, thankfully have been vaccinated. And I just think that this is an important conversation that needs to be had and obviously carried forward to encourage more to, when you look at what's good for our whole community, protecting our families, our friends, our loved ones, our coworkers, everyone in our community, it's an important conversation to have for sure. Talk about on your end, some of the things that you wish everyone knew in terms of what you all do. So what are some hidden secrets that you wish everyone knew?
This one's very personal to us. We are married. We've been married for over 20 years.
To each other.
To each other, yeah, which is an accomplishment. We work long hours, and when we go home, one of us has to have the strength to say, you know what, we're home now. We're not going to talk about this. And it's very difficult because right now, as Shannon has said, we are in a pandemic and we do work continuously. But I think the separation of realizing that this is, this is our project. This is what we do. We enjoy it. We have fun together. But at the same time, we have 2 teenage children. I think you have to recognize it. So from my standpoint, I relish and love the opportunity to work with Shannon. It's taken me 20 years to get her to do this project. And she'll tell you, I started talking about this when we first met. But at the same time, you have to draw that line and say, this is our time. Whether we're, feeding the dogs or taking a walk, you have to have our time.
He's talking about the importance of work-life balance, which all of us, I think, need to examine in our own lives. I think I would leave you, Jeremy, with this about ZpMed and about what's interesting and unique. And I feel very strongly that the pharmacist has a role in a physician office because we bring to the table an expertise that helps patients stay safe. And having that discussion, having that expertise in a clinic is much better for the patient than having a pharmacist call from a local pharmacy, because you don't have that relationship with a physician. We at ZpMed, you're going to get expertise from internal medicine, from hospital medicine, from clinical pharmacy, from nurse practitioners, from x-ray technologists, to medical assistants, to front desk personnel that have 20, 30, 40 years with one of them in experience in aesthetics. You're going to get a group of people who are very talented and very grounded in what they do and what they love. And we offer a lot of different services, but we come at that with expertise. And we hope that the next time you're in need for a medical visit, you'll give us a try.
Well, that carries us to the last question, which is, where do we go to learn more? And also give a little bit of you mentioned kind of there's a membership side. So give a little bit of a description on that too.
Yeah.
Go to ZpMed.com. Our phone number is 901-701-7010. Our membership model is on the website, but basically our members are our priority. And we serve as both primary and urgent care resources for them, which is also different than your typical doctor's office. We keep people out of the ER because we have an urgent care center here. The membership model covers all of your visits throughout the year, both acute and primary. And you get 10% off on other services that we offer, like x-ray, like genetic visits with medicine, our supplements out front, our aesthetics, and we have an acupuncturist as well that we utilize for stress reduction and pain control. So all of those things are housed in our little clinic in Laurelwood. So come see us, please.
Absolutely. The website is ZUPMED.com. And so make sure everyone check them out. Dr. Shannon and Lloyd Finks, thank you for all you do. Thank you for coming on the show.
Thank you so much, Jeremy.
We enjoyed it. Thank you.